Hi, I'm Dr. Julie Steinauer. Today I want to talk to you about what age does your child need to be before they can do therapy on their own. Now that's kind of multiple topics in one, but we're going to cover all of them. Before I do that, however, I want to talk about how you can connect with us. If you're local, call us at 618-288-1489. If you're not local, go to our website, visionforlifeworks.com, and you can do one of two things. Either fill out a questionnaire and get some feedback about your vision, or you can click on the schedule consultation button and schedule a time to talk with me directly about your vision. Now let's talk about how old does your child have to be. Now there's a lot of topics really again here in one, but typically for kids who are starting in our clinic to do in-office therapy, they're going to be around the age of 3.5, maybe 4. If they're not speaking real distinctly and they're having some difficulty with language, we may wait until they're a little bit older. But a lot of our patients can start in the 3 to 4-year-old range. Now, most of the time they're going to be going back to the therapy room by themselves. If we have a communication problem, or if your child maybe is a special needs child, we may have their parent to go back with them. Most of the time that's not going to be the case, however. If we're working with you online for whatever reason that might be, you're definitely going to need to be present during the therapy session. In fact, most of the time we will be training you and teaching you the activities to do with your child, because at 3 we don't expect them to remember anything, and we don't even expect them to follow any kind of directions online. They'll be there to maybe do 1 or 2 things with the therapist just to see how it goes, but most of the time we'll be working with you. If they're older, obviously they'll be working one-on-one with the therapist in the office. No matter what age range they are older, they would be working one-to-one with the therapist while the parent was sitting out in our waiting area. If it's online, we do have an idea of kind of what works best. For most kids, not all kids, but until around the age of maybe 12 to 13, where they're starting to take more responsibility for themselves, we really need to have the patient present online, or the parent present online, to help us work with the patient. And the reason why is it's maturity and development, but it's also the ability to remember details of things that we tell them to do. We don't expect an 8-year-old child to remember the details of activities we tell them to do, especially if we're telling them 4, 5, or 6 activities. That would be the responsibility of the parent, so we would need to have you present in that online session. So I hope that clears up things as to what age range your child should or could be in order to work with us, by themselves versus working and having you present with them. One last thing I want to touch on is that no matter what the age, even if I have a patient who's in their 80s, if there are certain activities that work better having a partner, then there's no getting around it. That child or that patient cannot work without a partner. It's really hard. Now, we might be able to alter some things in the instance of working with an adult patient who, maybe just has no option to have a partner. We could potentially work around that, but it does make it difficult. There are quite a few different activities, depending especially on the diagnosis of the patient, that do require someone else to help you carry out the therapy. But in terms of children, it's especially important to make sure that the parent is the one who is managing what the child is doing. Even if you have a child who is somewhat responsible, you have to check in on them on certain activities to make sure that they're doing the activities correct. We want to be having a positive impact and making the changes that we need to. We don't want to have the individual doing the wrong thing or carrying out and conducting an activity the wrong way, and it just not being helpful for them. So there are many activities they can do on their own if they're old enough and mature enough, but there are several activities that they do require a parent to help them out with, or maybe an older sibling. Maybe it would be a teacher or a tutor or a babysitter or someone like that could help them. If you like this video and you feel like it would be useful, obviously hit the like button, but you can pass it on to someone if you think that they would benefit from it. If you haven't done so already, make sure that you subscribe to our channel so that you get all notifications of all of our videos. Thank you.